Hello, friends. Bill back again. This week's vlog, I believe this is the first new vlog of 2023, is all about healthcare growth strategy. Now, I've read and listened to no less than a dozen articles and podcasts over the last 3 to 4 weeks, specifically about healthcare growth strategies for 2023. And interestingly enough, we have been talking about some of these strategies throughout the Q3 and Q4 22, and maybe not even realizing it. But what's dominating the conversations for the healthcare marketing firms like Reputation Sensei and others is one, consumerization of healthcare and understanding that your patient is a consumer and they need to be treated as such. Number two, COVID really changed how telehealth is being used and technology along with telehealth. So there's a real focus on communication and patient experience. And there is now an expectation from the patient side that doctor visits and access be easy and quick. So the two things I want to talk about today as a growth strategy are patient experience and understanding the consumerization aspect of that experience. Telehealth and communication, what is that doing? And how can we feather these two phenomena into a growth strategy that really moves the needle right away in 23 and beyond? So first, patient experience. At Reputation Sensei, we talk about patient experience all the time. We talk about a digital strategy founded firmly upon the fact that your patients are receiving outstanding service and an outstanding patient-centered treatment and experience throughout your office and throughout your communication. And that is a number one most important for 23. And with the ease and frequency that telehealth and Zoom consultations and app consultations, people, and of course, there's been an advent of new telehealth centered healthcare providers that are different from insurance. They're different from traditional healthcare, whether this is marketed through social media or influencer marketing, whether it's through mental health, whether it's through anti-aging, aesthetics. I know as a man, I'm seeing, Roman and hymns all over social media. And the idea that I can go on an app and have a consultation and be prescribed something that truly moves the needle for me is pretty impactful. So this idea that patients as consumers have an expectation of technology and service is something that you're going to really need to be focused on. So what does this mean? Well, what it means is if you don't have an all-in-one communication hub in place, if you're not aware of how the patient is experiencing your communications, whether it's according to your standards or theirs, that's something that we can help you with. Because right now, our all-in-one communication hub, our marketing automation platform allows for patient communication preference to be established. So whether a patient prefers to be communicated to through text, email, direct message through Facebook or Instagram, it can be done. Web chat. So again, we want to make sure that the information gets to them, but gets to them in a manner and medium that they choose. So that personal communication preference is going to be very important. And this is what you need to make sure your EMR or CRM or appointment reminder system has the ability to communicate in a myriad of ways, and ours does. So if we're not currently serving your omnipresent, omnichannel communication strategy, please click the link below, schedule a conversation with me. I'd be more than happy to go over it with you. It's so simple to implement. It's so affordable. It actually makes you money because it keeps the patient value present and top of mind at all times, which keeps that relationship in a position of mutually beneficial, which is really where we want to be, right? So again, I'd love to have that conversation. The second half of this is understanding the patient experience and how it leads to reputation marketing. Again, super proud of the fact that this is something we've been talking about for forever here at Reputation Sensei. I mean, we branded our organization based on reputation marketing and our belief that it is the single most effective way to differentiate your practice from your competitors and really make people feel seen and validated. Never going to be more important than it is right now. So make sure that your staff and your team members know that the first impression is super important. The work they're doing is super valuable. Understanding and communicating and making and validating the patient throughout the experience, whether it's in the waiting room or in the examination room or upon checkout or upon scheduling their next consultation or appointment. That experience is super important. And that experience, when executed best in class, actually feathers right into the feedback and the importance that a sound communication, two-way communication has in the cycle of converting an awesome patient experience with sound feedback, awesome reviews, the ability to market those reviews, and then finally take the marketing of that reviews either boosted with ads or not. I mean, that's really up to you. We can do both, but then take that advertising campaign either through Facebook or Google, proactive or reactive, and get more patients and more business as a result of those efforts. And again, on the patient-centric side, making sure that your patients are aware of the value that you're delivering, the differentiating factors of your practice to your competitors, whether those differences are in experience and expertise, whether it's in experience of the office itself or your staff, the multiple locations, telehealth, virtual communications, online visits, app development, app communication, social media communication. These are all very important, and they can really be the difference between success and failure or growth and stagnation. So the growth strategies for 2023, Q1 and continuing throughout the year, are going to be focused on patient experience and patient-centered communication. And of course, that feedback loop and the reputation marketing cycle that we always talk about. So again, we are launching our marketing automation platform. It's an all-in-one two-way communication hub. It allows for text, web chat, social media, direct message, as well as email. Super easy. We operate it for our clients on their behalf. It integrates fully within their EMR and their practice management software, which makes it super simple to get that data. It's fully HIPAA compliant, and it's absolutely outstanding. It's a game changer. And it communicates through our analytics platform, which communicates the data in real time to practice managers and doctors alike. And then that can in turn drive our proactive growth strategy, advertising, and marketing programs. All of this then communicates back into the centralized communication window where you can receive, as a practice manager or a physician, all the meaningful metrics that matter. And now you can actually reverse engineer whatever amount of growth you set for yourself for 2023. So again, click the link below. Let's have a conversation. We can talk marketing automation. We can talk the consumerization of healthcare. We can certainly talk about patient experience and differentiation. We could talk about telehealth and technology, but really the focus for 23 is patient-centered, understanding that we exist to serve others, and the marketing should indicate that, as well as all of your content as well. So hopefully this was super helpful. This is going to be a game changer for a lot of people. Reach out below. I would love the opportunity to have a conversation with you. Once again, this is Bill signing off. First vlog of 2023. I'll talk to you soon.